Hello everyone. Today we have a Dr. Rajendra Modiya. He having total 15 years of experience. He is currently working in S.B.B. College of Physiotherapy as a junior lecturer. So today's agenda of the interview is to know about thoughts of education. So let's begin with the interview, sir. My first question is to you. Being the faculty of ortho and sports department, what are your roles and responsibility toward the students?
Hi, as a faculty in orthopedic and sports department, we have various different patients who's coming with the different complaints, where we focus towards the basic pathomechanical changes in the patient, not what we correlate with the clinical presentation, and on the basis of the clinical evaluation and the biomechanical changes in the patient, we usually create the final clinical diagnosis, and based on that we focus towards the rehabilitation program. Patient presents with a different level of injuries, different level of disease. According to that, from base to advanced level of techniques what we have in our department, we go theoretical as well as the practical approach both for the patient and for the students. So we can start explaining from the what the normal biomechanical changes are there into the patient and what are the pathomechanical changes has led to the clinical presentation for the patient. And based on that, we try to correct the biomechanical aspect, and by the correcting the biomechanical aspect, usually we try to prevent the recurrence of the disease or the injuries. That's why the students get the clinical information, biomechanical approach from starting from the basic techniques to the advanced techniques. And usually we keep the track record of the patients from beginning of the treatment session till patient becomes to functional activity. So that way patient gets the total treatment ideas as well as the students gets the record of the basic till they becomes the functional into the activity level. That way we can help both the ways to the patient as well as the students.
Okay, that's great, sir. So my next question is to you, sir. How do you tend to establish healthy relations with the students and the fellow faculty?
Yes, it is very important to have healthy relationships with the patient, students and the other faculties working together. If the working environment is good, then the individual can get concentrated and get benefited from all the aspect which is required for the current and future for their skills. So I always try to neutralize with all my fellow student as well as the fellow faculties, so we can help to each other, we can learn from each other, and we can convey the necessary skills and what we are in the aim for the education that can be served properly.
Okay, that's great, sir. So my next question is to you, sir. How do you try to being the practical approach toward the subject and how you make it industry oriented?
Well, the orthopedic and sports department, where usually patients are in the clinical conditions where usually they are not able to attend the routine activity or the functional activity, and because of this usually patients comes to us, and as a being faculty in the orthopedic and sports department, we have the role to get the patient become functional and independent into their day-to-day activity, and it is biggest challenge for the patient as well as for the therapist. If I think about the patient themselves, usually they loses lot of bread and butter because of the disability or inactivity due to the injuries. The requirement of the individual is to get back to the normal functional activity. If you think or if you see other aspect from the therapist point of view, therapist has the aims for their work, and usually in the orthopedic and sports conditions, usually therapists are able to make patient most of the time 95 to 100% towards the normal functional activity. So for the patient as well as for the therapist, it is quite great achieving goal towards their work.
Okay, great, sir. So my next question is to you. What are the best practice offered by the department to the students which help them to gain the necessary skills?
Well, this is basic and the most important aspect for the development of the skill into the therapist. Usually we have referral patient system here, as well as the patient comes directly to the department. Once the patient comes to our department, usually it is scrutinized according to the involvement of the patient, like neuro patient goes into the neuro department, cardio patient or respiratory disease involved goes to the cardiorespiratory department, orthopedic conditions and related disease comes to us. So when patient comes to us, we usually get evaluated the patient by the students, which is the final year intern and the post-graduation students. Once the theoretical and practically totally the patient is evaluated, after that it is cross-checked by the faculty and correlated with the presentation by the student, and we try to recheck what the first person has done. So it is always double check from the student as well as the faculty point of view, and that's how the clinical diagnosis and treatment approaches are made, right? So for the student, it is cross-checking what they have done, whether they have done properly or not. So student get confidence into the clinical evaluation as well as their treatment plans.
Okay, that's great, sir. So my last question is to you, sir. What are your views upon the placement and higher education about the student from your department, and how does your department prepare student for the higher education?
Yes, the department where we usually see the patients and treating the patient, usually we start from basic like anatomy, biomechanical aspect, and then detail about this basic anatomy and biomechanical changes that is correlated in the patient complaints, patient's activity, and depends on that. Usually we try to correlate with theoretical aspect as well as the practical aspect. So students comes to know how the anatomy functions, how the biomechanical structures are working with that, and depends on that, and according to the presentation, the point to point all the aspects are covered, right? And according to this, the students are getting theoretical aspect of each and every conditions from basic till advanced. So education point of view and the orientation of the students remain clinical as well as theoretical. Both the ways students are getting enhanced in their skills, and that's how it helps to get the basic education, and that will also help to develop the higher education. So on the way, basic skill till advanced skill all are getting practiced at our place. So that's how the students are getting prepared for further education as well.
Okay, that's great thought, sir. Now I would like to conclude the interview. Thank you for such all information. It is very helpful for the all student and the parents. Thank you so much, sir.
Thank you.